Welcome to DocTalk. This is Brent Leavitt, proprietor of Battleborn Financial Advisor and health insurance broker here in Pahrump, Nevada. We also have offices in Las Vegas where this is also being broadcast on KPVM. We'd love to welcome here today. We're joined here virtually as we talk about with medical stuff is there's a bit of a surge with regards to COVID-19 right now. And we're trying to make sure we're even more protected than ever as we go through these holiday season and open enrollment's pretty much coming to a close as we watch this. But we want to talk, we brought back our very first guest on the show. It's Dr. Marianne Hazlett. She has been phenomenal. One of our favorite people here. She's willing to be my guinea pig at the first show and talk with us a little bit more. And we're going to talk a little bit about, in this lesson, we want to talk a little bit about COVID-19, talk about a lot of our Medicare plans this year because of COVID-19, we're relying more upon a lot of the virtual stuff. We're doing a lot more phone things. And I think a lot of people are making you might make a mistake on your choices. And we want to go over that a little bit during this lesson right here, or this TV show, and talk to you guys about what to expect. And Dr. Hazlett is going to talk a little bit about what she recommends to keep yourself safe during this COVID-19 kind of crisis right now as things get worse and worse and worse. We want to make sure we're protecting yourselves, protecting you. We have some joint clients that right now that we're talking about the fact that they have COVID-19 right now. And it's like, it's kind of interesting to see like, oh man, I really feel bad for them. Hope that they're getting better and that we're not worried about them not getting well. So it's very important we do that. And a lot of people, if you're starting to show symptoms, it's important that you go see your doctor and get that healthcare needs. And we can do a lot of virtual visits like this even where we're talking on a Zoom meeting, which is kind of really kind of neat. And you're watching on TV. So we do have that option. Now, if you need help with your health insurance needs and you're worried about did I buy the right plan? Did I not? Open enrollment for under 65 stuff is extended to January 15th this year. So we have plenty of time to make choices and changes. For Medicare, it still ended December 7th, but we'll talk about it later, but you do have some time between January 1st and March 31st if you made a mistake. Even if you have a plan that's being discontinued right now, like Select Health, they have some of their plans being discontinued. You have until the end of the month to get a plan change. So it's not like you're stuck in the middle of, oh, crud, I made a mistake and I need to fix it. You can still have time to do that. So let's talk a little bit about when you first started talking, Dr. Hazlett. Sorry, I know I took the show a little bit from you. We talked a little bit at the beginning is, people come in your office sometimes and you don't realize their insurance changed on you. What is that like usually for people?
Well, a lot of new plans, I think it's mainly like in the Aetna or Blue Cross that used to be a secondary to Medicare. Now, all of a sudden, they kind of took over for Medicare. So that is really the only card that they need to present. So we do find that there are some changes. It does change where we send people for labs or for imaging and what we have to get, a prior authorization on. So there are some changes. So we just always need to get the updated card every time you come in because they do have little slight changes, and it's always good to know what we need to do so that we can make sure that patients can get their medications, their labs, everything that we need to order for them.
Yeah, and you need to make sure too that when you bought these plans, hopefully if you bought them yourself, you made sure that Dr. Hazlett was even on your network if you want to see her still, because I know sometimes people get these wrong plans. They're like, oh, I bought this nice Aetna Prime plan, and they said Dr. Hazlett was in the network, and come to find out, oh no, she's not. She's on the Premier plan, not the Prime one. And so you got the wrong plan. And so it's like, well, wait a minute, I got to be able to see Dr. Hazlett. So you got to make sure you're doing that right. And if you made that mistake and you bring it to the doctor's office between January 1st and March 31st, you kind of get this one-time, oopsie, I made a mistake in Medicare stuff. So you can actually change your plan one time during that open enrollment period. So it's like you walk in the door and maybe you bought the wrong plan that Dr. Hazlett just wasn't on. You can still call Battleborn Financial, say, Brent, I need some help. And we'll switch you over and get to the right plan. That sees Dr. Hazlett, because it's important that you get the care you need. It's very important. And Dr. Hazlett, you're taking some new plans this year. I mean, we got this new Select Health plan for the under 65 stuff. You're still on the Anthem Pathway Network. I think you're my most, you take pretty much every plan on Nevada Health Link, except for one. And that is the new Friday Health Plan. You're the only one that's the only one you don't take. But you do take all the other plans, whether it be Ambetter, Health Plan of Nevada, Anthem, and then you even take the, missed one of them, but I can't remember all of them. You take 4 of the 5.
When it comes to the Medicare, I know I'm an affiliate for Intermountain, or previously Healthcare Partners. So of course we still have Humana Gold, and now they offer the Select HMO Medicare plan as well. So I'm definitely on the Select, both the PPO and the HMO. So anyone that had Select before, I think it was through a different company or organization, now it's all going through the Healthcare Partners, and we do take that.
Yep.
So
and you also,
both the HMO, Medicare Advantage, all of that.
And people are on United Healthcare. They don't know, as people realize that this year, if you're on United Healthcare, every single United Healthcare plan, with exception to the Focus plan, Dr. Hazlett is actually a provider on. So if you're on United Healthcare, you can see Dr. Hazlett. So it's pretty neat with United Healthcare how you can see them. She also is contracted with the Anthem HMO, which is through Optum Network. So it's kind of weird how it accesses that same HPN contract with that one. But you can also access her on Anthem through Optum, which is the same as Health Plan Nevada's network, which is kind of cool. So
because I didn't know that either.
yeah, it's kind of a weird thing I found that you're on. I was like, that's kind of interesting. So United Healthcare Products, Anthem, she takes quite a few, and she's quite diverse. And I think that's something that we love about Dr. Hazlett. She lives here locally. She's been in her community it's been almost like 3 or 4 years now, I think, right? You lived out here?
Yes.
And her parents are out here. What's that?
I said about 3 years.
3 years, yeah. And so we've seen her from this practice where it's like you're working from the hospital, kind of like just barely building it up, and now it's like you're growing, and now you have a whole bunch of, you have like, what, I think 2 PAs working for you now that help out with seeing patients.
Yeah, I have a nurse practitioner, Dawn Simpson, and she's really good. She also does women's health, so she takes care of that realm. She's great with diabetes and with migraines, so she adds a lot to the practice, and she sees patients. She also does our walk-in appointments, so anyone who's sick that needs to be seen right away, we have that covered. So she's great, and everyone really loves her. She's really sweet.
Yeah, so we always talk about access to care, and that's the biggest frustration. It's like, I want to see my doctor. And it's always, and Dr. Hazlett's getting so popular, she's getting further and further booked, which is a great thing.
Sorry.
Oh yeah, she's getting booked, and she's getting further and further out. So she added on that nurse practitioner. Her name is Dawn. And she's really great, and she's really awesome, and she'll take care of you, same-day appointments, diabetes, women's care. So just make sure you know that to do that. And what's your phone number, by the way, Dr. Hazlett? Let's put it up on the screen a little bit. So they can contact you.
It is 775-771-7570.
And if you're wondering what she's located, she's actually located off of, I always tell people it's off of near Homestead and 160, which is just a few blocks, just a few buildings down from like the Maverick station. So people that know where she's at, it's easy to get a hold of her. The office is pretty easy to get into from the 160. And you can come in and see her, same day appointments if you're sick. And don't be afraid. Like right now, I know if you're feeling symptoms of COVID or anything like that, that it's important you talk to your doctor right away, because the more you put it off, the more your body gets, it can attack your body more, and especially if you have like any kind of pre-existing conditions, that can be a big concern for you. Are there certain things or precautions you guys are taking, or what you recommend for people that are dealing with this COVID stuff right now?
Absolutely. Most of my patients, as they know, I highly recommend vitamin D3, and who knew that would actually be something that prevents COVID and helps, the virus not to attack you. So vitamin D3 is really important, but you have to take zinc every day, because if you got the virus, it would prevent the virus from shedding. You also need vitamin C. So that's kind of the 3 cocktail that I recommend that I do daily is zinc, vitamin C, and vitamin D3. And that's the most protection, of course. Staying away from people. I mean, the spread is it is in the air, and we definitely have a flare right now. There's a lot of people in Pahrump. We had very low numbers, and those numbers are expanding now, as everyone knows. So really, staying away from people that are sick. Even if you're wearing a mask, you're doing everything you're supposed to do. If you're sick, please stay home. Do not spread this. There's people just with fatigue. There's people just with headaches, just a little cold-like symptom, and they're actually positive. So they don't have the fever. They don't have the traditional symptoms that we saw earlier in the year. They have very mild symptoms, but they definitely are positive for COVID. So if you have any symptoms like this, stay home for 14 days. Don't spread it. Don't go around loved ones, especially elderly people that have pre-existing conditions.
That could be a big concern. I mean, I know some people are like, well, I don't want to wear masks. I don't want to do things. But it's not just about that. It's whether you pull politics or anything aside, it's just making sure that you're being respectful of other people and trying to keep it from getting worse.
Oh, absolutely.
Yeah, and those vitamins are important too. I mean, they're sold, those vitamins you're talking about, they're sold through a lot of different places. Like, not hard to find the vitamin D3s and things like that. You sell supplements in your office too, don't you?
We do have supplements. We have different types for different things. So a lot of people want to do natural medicine, which I agree with fully. So instead of taking prescription medication, we do have other options. But the zinc, D3, those are always at our office. Vitamin C, those are smart things. Hard to get now, the zinc. So you may need to go online and try to see what you can find anywhere you can, because people know now. But also, if you're sick, we do phone appointments. So, someone who's actively sick or has COVID does not come into the office. We also will go out in the car and do testing. But from what we understand, CVS also does the drive-through testing right now. So you can stay in your car. You actually perform your own test. It's not that deep swab that hurts. And it's very accurate. And they get that done in a few days. And I believe they do bill insurance and everything as well. So you do have that option if you feel sick to go to CVS, find out if you have it.
Now, are they doing testing at your office as well, as you said?
We come out to the car, yes. So if you're sick, we have you stay in your car, call us, and then we go out to the car and see you at your car so that there's no spread of disease. We don't have to worry about you being around other patients that are healthy.
Are you a rapid test as well, or is it like a 3 days or something like that turnaround time?
It's interesting because they say it takes 3 to 5 days. It's not the rapid test. But if you're positive, we get that result back usually within 24, 48 hours. So it's interesting. The ones that are positive, we get back immediately. The ones that are negative usually take 3 to 5 days.
It's like, maybe you're negative, so we're going to wait a little bit and make sure it's...
It's kind of interesting. But then we also, of course, the blood tests, we send those out all the time for the antibodies to see if you had it, if you're sick, if you want to know if you're possibly immune. We also can order that testing as well.
We're going to take a little quick break back and talk a little bit more. Just a reminder, we're with Dr. Hazlett with her Marianne Hazlett's medical group here in Pahrump, Nevada. And we're going to talk more about COVID stuff and testing, and we'll be back after the break. All right. Hey, we're back to DocTalk. I'm Brent Leavitt with Battleborn Financial Advisor and Health Insurance Broker here in Pahrump, Nevada. We also have offices in Las Vegas, Nevada. We are here to help you with your questions and answers about medical care and primary care specifically here today. We're joined again with Dr. Marianne Hazlett. She has been our first guinea pig on our show. She's back talking again to us. Virtual meeting here because we're trying to stay even safer right now, especially as COVID-19 is kind of getting worse and worse, and we're seeing a surge of cases right now. It's important that we talk about those things. And open enrollment being right now going on. Medicare ended December 7th. But health insurance under 65 goes all the way through January 15th this year. We have plenty of time, so please give us a call, 775-764-2252, and get in to see us to talk about your healthcare needs. If you want to see Dr. Hazlett, she is one of our most robust providers. She works with all the different insurance companies, pretty much all of them except for maybe one. But she's wonderful, really easy to get a hold of. She is now a nurse practitioner. We talked about that. Dawn, she'll get you in to see same day if you're sick. If you're feeling symptoms of COVID or flu stuff, don't be afraid to talk to your doctor. They'll see you and they'll see you out in your car and just swab you and take care of you. We talked a little bit, I forgot about it in our last session. We talked about the important vitamins to take, which you said were zinc, vitamin C, and vitamin D3. A lot of people, if you're on Medicare, especially in the Medicare Advantage plans, you get a thing called an over-the-counter benefit. Every 3 months, most of these companies, like carriers, especially the HMOs, and we're talking specifically, Dr. Hazlett, she takes 3 of them, or 4 actually. She takes the Humana Gold Plus plans. She also takes the United Healthcare plans, except for the Focus. She also takes the Select Health plans for next year, and she's also taking the Anthem HMO next year too. And all of them have these over-the-counter benefits. They range in between $30 to $100 a quarter that you can get these supplies, and you can actually get vitamins through those over-the-counter supplies. So you can actually look at your vitamin D3, you can get your vitamin C and your zinc through those mail order programs. So it's important that you utilize those catalogs and use your benefits. If you have questions about those or want to get more benefits and see if you have them, give my office a call. We can help take care of you. But before we left, I kind of took a tangent there, Dr. Hazlett. Talk to us a little bit about, we've mentioned about the testing and what's kind of changing a little bit about that. Tell us a little bit more. You were mentioning, if you go to CVS or something like that, they're starting to charge more for it now.
Well, CVS should be able to bill your insurance. As long as you have symptoms, you're getting a test, they should be able to bill the insurance. Otherwise, they do charge, I believe it's $139. Quest and LabCorp, if you have symptoms, you come to our office or we see you at your car and we send in a swab with symptoms, your insurance is billed. If you just want to be tested because, let's say, you work in a healthcare facility and they require you to be tested, that is no longer covered, and they do require that you pay for testing if you're not sick. So if you're sick, your insurance would cover it. If you're not sick, then they want to be paid up front. So that's a little bit different. I know they have rapid testing in Las Vegas, which is all cash pay up front. They will let you know right away if you have it or not. Unfortunately, they don't have any rapid testing that I'm aware of here in Pahrump. But if you have the symptoms, you should be able to get back your result within 24, 48 hours, especially if you're positive. So if you do come see us or see your doctor and they do a test or a swab, they should be able to tell you pretty quickly. And then you know if you need to be quarantined or not.
Yeah. I think Spring Mountain Medical said that in our last episode that they do have some rapid testing available there, I believe, at Spring Mountain Medical, too.
What did you say?
Oh, I believe at Spring Mountain Medical, at our last episode, they mentioned that they do also have some rapid tests available at Spring Mountain Medical.
Oh, okay, wonderful.
So
okay, that's good to know.
Most of those, like you mentioned,
are
cash pay. It's hard to get the insurance pay for those because they want you to make sure that you're going through proper channels. And in fact, we mentioned that right now, recently, there's a couple different vaccines that are coming out now with regards to, we have about 3 or 4 that have passed trials and are going to start distributing. I know that we just got an announcement from Health Plan Nevada and Sierra Health and Life that they're already telling us that they're going to cover those at zero copay when they do come out. I'm assuming that we're going to see all the carriers probably follow suit, all the insurance companies next year. I'm going to probably bet they're going to start saying we're going to cover those at zero cost too. Are there any things that you've seen or you're preparing yourself to prepare for those vaccines? Have you?
Traditionally here in Pahrump, vaccines are given like at CVS, Walgreens, Walmart. So it's usually at the pharmacies where the vaccines are provided, just like the flu shots or shingles or anything else. So I'm assuming that they will be doing that. I know there's 3 different vaccines that I'm aware of. One of them is just like a traditional old-fashioned type of vaccine, like a flu shot, but 2 of them are supposedly they alter or they work with your DNA and RNA. So I'd sure like to know a little bit more about what that is before I would recommend that to anybody. Personally, because vaccines usually take a long time, at least a full year since a virus, in order to really be, like when H1N1 was out, the following year, that particular flu shot also covered H1N1. The fact that it hasn't really been a year that they've been working on this vaccine, I would take some caution in getting one until we actually know a little bit more, but that's my personal opinion. That everyone needs to do what they feel like will make them safe.
So we'll have those available probably next year. Tell us a little bit about, now, we mentioned before, I was kind of curious to have a discussion about COVID and things like that right now, maybe it's hot on my mind. We mentioned that you test also for people that have the antibodies and stuff. Have you found that people, usually when they get the antibodies, they are susceptible to getting it again a lot of times, or is that pretty much, is that a concern still for a lot of people?
We don't know for sure about it. We assume as long as the virus is not mutated, and it's the same virus that we had back in March, April, May when it was so bad. If it's the same virus and you had it back then you should be immune. Your body should have made antibodies and you should be safe not to get another course of this. But we don't really know. A lot of people who were told they were positive, their antibodies are indeed positive. We do have people that their rapid test was positive, their antibodies are negative. So we know there's a good percent of those antibody tests, somewhere between 50 and 80% that are not accurate. In which direction, it's hard to determine what that is, because we do have people that also were never sick or aware of it, but they have antibodies that are positive. So they may have been a carrier with very, very mild symptoms, something that they really thought was allergies or fatigue or for some other reason, and they actually did have COVID at some point earlier in the year.
Yeah. Well, it's always interesting. It's tough to figure that out with regards to, are you sick or not, and trying to make sure that I know a lot of us, we think like we've been sick at one point or another. We just didn't realize the tests were just, it's been tough to figure out the accuracy of those too. And, they kind of push those out pretty quickly, and it seems like they're getting more accurate, but it's questionable sometimes.
Oh, definitely. Because I have patients that were very sick back November and December that swear that they've had it. Their antibodies are negative, but who's to say, because the testing has gotten better and more accurate. So it's hard to say if they really are immune at this point or not. I think just taking care of yourself, of course, lots of fruits, vegetables, being really healthy, taking some supplements, and staying away from people that are sick. Or if your friend tells you, oh, I've been really tired the last 2 weeks, no cough, but I just don't really feel well, just kind of stay away from them until they feel better, until they're back to normal, because there's some very vague symptoms, and people have been positive where literally they said, I felt tired for 3 days, and they did have the virus. Of course, they had higher chance of getting it working in hospitals in Las Vegas, but still they were positive, their antibodies are positive. So you have to just really be careful and be safe.
And a lot of people think it's respiratory stuff. I had a few clients that were actually hospitalized for some heart stuff and things like that related to COVID. And it was interesting.
Well, there's a lot of patients, there's a lot of people that have had coronavirus, that had the upper respiratory, they had the fevers, they've had the cough, they've had all the typical symptoms, got over it, but it did put a strain on their heart. If anybody has tested positive, you need to get an echocardiogram, have your heart checked, make sure it's okay. There's also some risks of bleeding, blood clots. There's a lot of long-term things, also dizziness. There's been a lot of neurological symptoms. There's things that continue months after you've had the initial COVID where you just don't feel right, and there's symptoms popping up months later. So you need to at least have your heart checked out, make sure you're getting some regular blood panels, at least, I would say, every 3 months for probably at least 6 months, just to make sure that nothing has changed. And if you feel any hot, red, swollen extremities, anything where you could have a blood clot, I mean, your chance of having blood clots are higher, chance of having some issues with your heart. These are all really serious, and residual lung issues as well.
Are you doing a lot of the echoes and stuff in your office, or is that something you send off to like Dr. Eric's office for?
We do echo, well, depending, of course, on insurance and what is authorized. We do echocardiogram. We also do vascular studies in our office, as well as ultrasound. And depending if, different insurances, if they need to see a cardiologist, then they go to Dr. Eric, they go to Dr. Rhodes. There's 2 cardiologists in town that are happy to do echoes and cardiac PET and whatever you need to assess further anything that you could have going on post-COVID.
Definitely. Are there any things right now that's like big for people that you want these people to know here in Great and Pahrump, and let them know about your office, or things that are important right now?
Well, really staying safe and staying healthy. It's so important. And you do want to see your doctor, even if it's a phone visit or a video call, if you don't feel safe going into a practice, especially because, people are sick right now, and people are also sick with flus and colds and regular things that are not coronavirus. But at the same time, we have those options so that you can call, at least talk, get your labs ordered, go over all of your testing. You don't have to be in person. If you're having any symptoms, especially heart type symptoms, shortness of breath, feeling, swelling, anything abnormal, those need an actual physical, and you need to come in and see a doctor just to make sure that everything's okay, especially if you were sick earlier in the year. Even if you didn't have any COVID testing, make sure that you didn't have something, serious that is affecting you. So delaying healthcare is not a good thing. I have a lot of people saying, oh, I don't want to have a mammogram, I don't want to do my colonoscopy, I want to wait till next year. That's not a good thing, especially if you're having any kind of issue. You really want to stay on top of these things so that you don't have a problem. But getting, your regular test is very important.
You never know what's going to happen. Like, we found out my own mother had like a brain tumor, during this whole COVID stuff, and it's been crazy. Not finding little things like that, you don't know what's going to happen. So our time's running out. We're going to kind of close a little bit right now. I'm going to put a little bit of a thing just so you guys know. Dr. Hazel is an old. She was an actress at one point. Just we'll put that out there so you guys know she's famous. Also, too, there's also, if you're surfing on HBO, there's a new movie out called Baby God that I'm actually in. It just came out on the 2nd of December. So watch Baby God. I'm putting that in my own TV show saying, watch the movie. If you guys want to know a little bit about who Brent is in this town, it's kind of crazy. So I know Deanna wants to get an interview with me about it, but just put that out there so you guys know. But thanks so much for joining us today. If you have questions about your healthcare needs, call Dr. Hazel's office, get an appointment. If you want to get help with your health insurance, call Battleborn Financial. We'll help you out here locally. And we'll see you guys again next week. Thank you so much for joining us.